Okay, I think I have this started. Hello, everyone. I am Dr. Jennifer Mellick from Pediatric Partners, and it is September 11th in 2020. So I think today we had discussed at the office that I would do some updating on some office protocols and letting everybody know what is new at our office. So first of all, I am having kind of a half day today. So I worked this morning and I am now currently at home. So if you hear my dog in the background jingling her collar, she's upset because she's not getting attention. She is also currently being pretty naughty. Let's see if I can show you her. There's my dog. She's currently on the carpet, which she is not allowed to do at our house. So she's really basically behaving like a toddler and seeing if she can't get my attention to see if I will tell her to get off the carpet. So I'm going to ignore her and see if I can't get through my stuff. If my husband sees this later, she's going to be in trouble. No bones for her tonight, no treats. So, okay, so obviously, things are very different today than they were even 6 months ago. COVID has changed everything. It has changed the way that we live our lives. It has changed the way that we at Pediatric Partners are practicing in many ways. I like to believe that we are still providing really good care. We've been very careful in what kind of changes we have made in our office to make sure that we are not sacrificing good quality care just for the convenience of keeping people out of the office, so to speak. So we have always been, as I like to say, a group of very detail-oriented perfectionists, which I just had a conversation today with one of my office managers that can sometimes be to our detriment because we can't just settle. So we're always trying to do everything the very best that we can. But it has presented some challenges. And so the reason that I'm being so obvious about today being September 11th is because I think we've published some things about how things have changed before and things are a little bit different today. So one of the biggest things that I think we need to talk about based on the date is that our kids are back in school. And how has that changed things at our office? So for a very long time when the kids were home or in the summertime, we were not seeing as many sick children. I joked that we had the wellest April than I'd ever seen. I mean, we had, Aprils are pretty well anyway, other than allergies, but we had kids coming into well visits without snotty noses when they were less than 4. And kids who attend daycare in general just basically are snot from October to May, and that's just the way it is. We had not seen that. Well, we're starting to see that again. So kids are definitely starting to pass viruses. Including now, unfortunately, some COVID. We had started doing some testing in our office, either sending it out to a couple of the local hospitals, and I'll talk about that in a minute, as well as collecting samples and sending it to a lab directly in our office. About 3 weeks ago, I ran a report, and we had done a total of about 160 COVID tests in our office, and we had only had 7 positives. So my math is that's about a 4 to 5% positive rate. And all of those positives were in kids that were older than 10. We had one 11-year-old at that point in time, and then everybody else was 16 and above. So in the last couple of weeks, our total number, so this isn't just the ones that we've done in the last couple of weeks, but our total number when I ran the report on Tuesday was that we had done about 190 now COVID tests, and we had 13 positives, which I believe bumps our number up to about 5 to 6%. So not huge, but if you look at what we did in the last couple of weeks versus when we started, it's going up. And now we are starting to see some positives in 3-year-olds and 4-year-olds, and I think a 7-year-old and an 8-year-old. So we're starting to see that these kids are passing this. Interestingly enough, we looked back and I kind of drilled down into those charts, it did look that like most of those children were exposed by an adult. And so we still are not seeing a ton of child to child, at least right now, which we are really hoping is going to help the kids in school fare well, and meaning that they are not going to hopefully be catching it from each other and passing it there. So fingers crossed, as the kids are going back to school in person, either hybrid or full time, which obviously remains to be seen in most of the school districts. We're hoping that we are going to continue to see good infection control. But we are seeing the regular viruses. So we're seeing a little bit of strep. We're starting, which is not a virus, by the way, it's a bacteria. Sorry, again, my anal retentive, I have to be accurate. But we're seeing some strep, which we see a lot at the beginning of the school year. We are seeing some allergies picking back up. Again, not a virus. And then we're seeing other viral type infections, some kids with fevers that turn out not to be COVID. But the schools are often asking the child or the parents to take the child to get clearance from us at the office. And just to let you guys know, we really don't feel like we can just look at your kid over a telehealth call completely, or just have our nurses answer the question and we rubber stamp that your kid doesn't have COVID now and send them back to school. But we don't feel that that's probably in the best interest of public health. So if your child has been asked to go out of school and get clearance from the doctor, we are going to need to probably examine in some manner. If we really are highly suspicious that your child has COVID, like a direct exposure, high fever, they have loss of taste or smell, they have new onset cough, and they don't typically have coughs. I mean, some kids with asthma right now are having lots of coughs, but if your kid is not one of them, then we're probably going to need to see them in the office and take a listen to them. We may do some of that by telehealth first, and then have you come in and get the exam done, as well as do testing. And then look for other causes, right? We're going to be able to hear, is there a pneumonia, which we'll probably still swab for COVID because it can cause pneumonia, have secondary infection. Is it an ear infection? Is it strep throat? Is it something else? So we'll be doing that, and then we will be issuing clearance. So telehealth is not new, at least not since we started all of this COVID, and we had done some even before. So we'll continue doing that, but the best way to do that is if your child has been asked to leave school, please give us a call and we will help get you guys facilitated in seeing us in the correct manner. So that may be, like I said, begin with telehealth, and then we do an exam, and if the provider, the doctor or nurse practitioner feels like we have a good enough idea of what's going on, just have you drive up to the office, let us know we're there, and we will come out to the car and collect the sample for swabbing. Or if we feel like on our telehealth, I really need to look at these ears, we'll have you come into the office. The history will be done. So we are trying to limit your time in our office so that we're not obviously exposing lots of people in the office to each other, although we're still not having anybody wait in our waiting room. So getting you back so there's less exposure, but also trying to keep our staff healthy, and decreasing our exposure time to other sick kids. We have determined, we tried some car side visits, meaning that the provider, the doctor or the nurse practitioner came out to you guys. And we have found that while we were able to get quick looks in ears and throats, listen to chests, it's really not a full exam. And as the weather is turning, that is going to become more difficult. And we have enacted enough safety protocols. We now have not abundant supplies of PPE, of protective equipment, but definitely adequate supplies. We are able to get them in safely to the office, and so what we'll be doing is bringing you guys to the office. Occasionally, if we feel like your child has a high fever or lots of cough or something like that, our nurses may have you check in through the car, which you can actually text the office, it checks you in, and then have our nurses call and get most of the history in your vehicle, and then bring you in for the provider, the doctor, nurse practitioner to go ahead and examine in the room. It decreases the time in office, again, helping to keep our staff safe, as well as to keep you all safe and our other patients safe. We're trying to keep the office as a safe environment as possible. So the other thing that we are going to be kind of doing with things different this year is going to be our respiratory season. We kind of refer to this as our cold and cough, cold and flu season. RSV is another big part of our respiratory season. So there's going to be some changes because of some of the things that we used to do. For young infants, if they had significant snot secretions is what we call it, we would often bring them in and we would do a suctioning technique where we would pass a catheter through their nose down into the back of their throat and suction all of that out. It's called deep suction. Of course, there's a bigger medical term, but it doesn't matter. So what we're doing is basically having them, we're not able to do that. Children's Mercy is also not doing it. It had a clinic that they call the Respiratory Outpatient Clinic, or the ROC Clinic, that would allow us to send our babies, our infants, there after our hours so that they could receive suctioning. And sometimes that was one of the best ways to help kind of keep them from being hospitalized because they couldn't control their own secretions. So we're basically not able to do that because that's what's called an aerosolized generating procedure, or an AGP. And that places us at risk, and we have to have special rooms. So basically we have to have either negative pressure, or we have to close a room down for a very long period of time. We also have to have fit tested masks, which is not something that most of us are having a ton of access to in our pediatric offices. And the hospitals obviously are not able to do this either, since Children's Mercy won't be doing it. So we're going to be teaching you all old school. Before we had things like deep suctioning, we would teach people how to aspirate the nose themselves. Blue bulb syringes are sent home with each infant, but we're really big fans of the ones that apply more pressure or suction that comes more continuously. So Nose Frida is one of them. There's other brands out there. Some of them are electric, and saline. Our nurses will be able to walk you through this, but we're going to be teaching you guys how to do this so that we are not doing the AGP or aerosolized generating procedures in the office. The other big thing with cold and cough season is asthma and our asthmatics. The nebulizer treatment, the little machine thing that kind of makes lots of noise and generates a mist that the kids breathe in with a mask in the office, is considered an aerosolized generating procedure. So for those kids that come in with asthma exacerbations or asthma attacks, we are going to ask the families, if you have an asthmatic and you have an inhaler, an albuterol inhaler and a spacer, to bring that along. And we are going to be able to then help administer that, do the oxygen checks, do the exams, and safely take care of your asthmatic in the office. For those that have not been given a diagnosis, we are going to come up with alternate ways to administer albuterol, whether that be with a nebulizer that we are taking outside, or putting into your guys' car with windows down. And we have car side adapters to help basically administer this safely in an area that is not going to put the rest of our practice and our office and our nurses at risk, and close down our office, because you have to close the office and close the rooms for a period of time. I mean, we do a couple of these and, well, our office is going to have to be closed for a couple hours. So same situation as what Children's Mercy is doing. They're trying to look for alternate ways of doing these nebulizer treatments as well. The other thing that has been different is walk-in, and I'm going to ask for any thoughts, comments, or whatever you guys have any things, if you guys want to put them across the field here. I still am working on my Facebook Live etiquette, but if you have questions, just throw them up here, or suggestions. We're looking at ways to do potentially some on-demand telehealth. So we used to have walk-in, right? Your kid, you pick them up from school, they said, oh, my throat hurts, and they're running a little bit of a fever, they have a little cough, you want them swabbed for strep. You used to be able to just come to the office without an appointment. Well, because of COVID, we are wanting to make sure that we do not have people sitting in our waiting room and having like 5-6 people show up at one time. So we're doing same-day appointments. We are working you in. Please call. Please don't think that you can't come and see us, because we also don't want to send you to an urgent care where you're going to be sitting 6 people deep in a waiting room of coughing and sick people. We'd much rather have you come if we're open to our office. But we're looking for some ways through our telehealth platform to be able to offer some basically walk-in telehealth, meaning that we will tell you what hours that we're available. You guys are able to just enter into our waiting room. So more to come on that. But if you all think that's a great idea, let us know. The other thing that I think that we really have to kind of talk about right now as we're heading into it is flu season. So flu vaccine is here. You may have heard that the CDC had recommended waiting until a certain time to get your flu vaccines. That particular recommendation, just so you know, was really more for older adults. In pediatrics, I don't deal with older adults other than, parents and grandparents, whom I love, but I'm usually not taking care of your medical issues. But it is absolutely time now to go ahead and get your flu vaccines. We are trying to make sure that this is going to be given in a manner that is safest for your families. So we're trying something cool and something new this year. We're doing drive-through flu clinics. We're actually doing our first one this Saturday, so I guess that's tomorrow. And we are doing it at our Olathe location. We'll probably be having them at both if this goes well, but we're working out the kinks before we schedule more. So stay tuned. We will also have some in-office flu clinics as well for those that either have egg allergies or need to come in. And we are administering our flu vaccine to our patients in office. So if you happen to have an appointment, we will give the flu vaccine if you are well enough to get it, depending upon what you're coming in for. We'll also give it to any siblings that happen to be along. So if you know that baby Olivia is coming in for her well visit, her 9-month well visit, and you want to bring her brother Jimmy and her sister Suzanne, bring them along. That's fine, as long as they're well. Of course, everybody older than 2, we're asking to mask, please. And we are still trying to limit the number of adults in the office. Adults do seem to be the ones who are transmitting this more so than the kids. So I'd much rather, if the kids are able to be taken care of by one adult, just one adult. But I mean, if you're bringing in 2 newborns, you've got twins and, they're brothers so they can get the flu vaccine, we get it. Just, make sure everybody's masked and everybody is well. So flu, we'll have that kind of coming out as more clinics are coming. But really important for you guys, we are sending this information out that flu clinics are available, usually through our newsletters and through our portal. So make sure you guys are up to date on our portal. We're also, with our drive-through flu clinics, having you fill out the questionnaire to make sure that your child is safe to get the flu vaccine, that they're not sick and they don't have an allergy to neomycin and latex, they've not had Guillain-Barré, all of those things that nobody has any idea what we're talking about half the time. But these are important things. So we have you fill that out. So it's basically all ready to go. And then you can just literally drive through. At the drive-through flu clinics, if you decide to go that particular route, do remember that we are having to give an injection, or we do have some flu mist. But if your child is going to be getting an injection, we need to be able to get to their skin. So don't bring them in their 14 winter coats and their long pants and their, little sports leggings that every kid is wearing now. They're very cute, but we can't give an injection through that. So if your kid needs to have a thigh injection, meaning that they are a younger child, put them in shorts or a skirt. And if they need to have an injection in the arm, have them in short sleeves so that we're able to get to them. If it's cooler outside, we all do have heaters. So, warm your car. Blankets on the kids if they're infants and you need to cover their little legs. And this isn't going to take long. So it's going to be a roll down the window kind of thing, or just pop open the door and we're going to give the vaccine and off you guys are going to drive. So we're really excited about that. We will definitely be open to any suggestions, or if you guys think this is a great idea, let us know, or if there's something else that you think would be helpful. We really are here to serve you, and we are wanting to take care of our patients, so just communicate with us. Facebook's a great way. Message through the portal is also helpful as well. The last thing that kind of is on my list of the office protocols that I wanted to talk briefly about was the COVID positive kids and returning to athletics. There's been some new recommendations that have been released on the fact that some of these kids, and some adults probably as well, but again, I don't take care of adults if I can avoid it, they are having some possible inflammation in the heart after COVID infection. And this can cause problems as they return to play. So there's been some recommendations that are released stating what we do to help make sure that these kids are safe to return to play. We're seeing this much more right now in kids who are older than 10. Kids who are less than 10, again, they have less severe illness, and they tend to limit themselves, right? I mean, if a little kid is feeling short of breath and they're super tired, they usually let you know. You have your older athletes, they push through. And, I mean, I have an athlete. I've got a couple of athletes. My kids are fairly athletic, at least 2 out of the 4. Love you, the other 2. You have other talents as well. But they will be hurting and still be pushing through. And we don't want to have these kids then having heart damage. So less than 10, if they've had a COVID positive test, let us know so that we can give them instructions on return to play. Those that are older than 10 very likely are going to need clearance from a physician, nurse practitioner, so that we can do an exam on their heart, we can check their oxygen, and we can then give you guidelines of what to watch for as they return gently to play. This is going to probably be kind of like a progression to full activity, something similar to concussion return to play as well. We are not just going to be able to rubber stamp these things that KSHA, Kansas State High School Athletic Association, is asking you guys to have filled out. I could not live with myself if I rubber stamped something and said, sure, 15-year-old football player, go back to play, and they then have a really bad outcome and have a cardiac event on the field. Just because I said, sure, it's fine, I'm sure they're fine. So we just really want to take care of our patients. And so it's not going to be a rubber stamp. I'm sure that some parents are going to be very unhappy with us. And those of you who know me well know that I'm pretty plain spoken. If you're unhappy because you think that I am making things harder for your kid, but what I'm really trying to do is make sure that they are as healthy as they can be, tough. That's okay. My patient is your child, not you. And until they're being paid like Patrick Mahomes to play, we're going to make sure that they live to 18 and that they have an opportunity to win that scholarship and become the next Patrick Mahomes. So that's kind of the big things that I wanted to talk about. I think just one more thing before I kind of sign off. I want to make sure that everybody has access to our portal. With the COVID testing, we have found that is one of the best ways to give you guys the release and the instructions. So let's say your kid comes in and gets a COVID test, they get a swab. We are usually getting those back in somewhere between 2 and 4 days. It kind of depends upon when the child gets swabbed, because the lab can only run so many in a day. Where we are in the week, I don't think most of the labs are doing them on the weekend. And then, how busy the lab is. But it's a pretty quick turnaround, so to speak. But if it's positive, we are then going to give instructions on, okay, your child tested positive. This is when they may return to school based upon positive test, or your child was exposed and this is how long that they have to quarantine or whatever. And all of that on the portal will be available for you to print out and give to the schools, the coaches. It's also going to have instructions on athletes and when they can then return to play. And you can use that as clearance for us. So if you don't have access to your portal and you guys are coming in, just ask our front office staff. They're happy to help you. So I think that's pretty much it. Hopefully, if you guys had any questions, I didn't see any come across, but I'll look when I'm done and I can answer them off the live piece of it as well. But let us know. Just on a personal note, I think I talked a little bit about what I was doing in my household and how some of that has changed. A lot of that has pretty much continued the same. One of the things I get parents say to me all the time is, wow, I haven't ever seen you in scrubs. So, maybe I should comment on that. I didn't think anybody ever paid attention to how I look. Clearly I have no makeup on today. So But yes, we're wearing scrubs in the office. It's not because we want to be informal, but they are easy to bring home and throw into a washer with hot water and not have to worry about ruining clothes. I'm still showering when I get home. I'm making my kids do the same. I do have a kid who is going in person right now, full time, and those that go to school then on their hybrid days, they have to come home and they have to strip and they have to shower. And I mean, maybe that's overkill, but we're using a little extra water, I guess, but I'd much rather my kids not get this. We're trying to eat healthy, and we're trying to get enough sleep, and we're trying to find our joy where we can, because we still are staying pretty close to home. I'm not saying that we don't have our pod of people. Each of them has kind of a friend or two that they are allowed to see, as long as that friend or two is continuing to do good social distancing. Those are the big things. But I was so excited the other day because I thought I was going to get to go watch my daughter cheer, but it turned out that they weren't letting visiting cheerleaders come, so we couldn't do that. I've got 2 in college. They're gone, so that's changed life a little bit. Less exposure because they're no longer here and working. So it's just now my husband and I working, and trying not to bring it home. And my dog is in the sadness of life. See, she's still on the carpet. I'm going to have to deal with this here in a minute. But don't worry. She's just going to get sternly reprimanded. And then probably lots of snuggles. But she is very sad that all of her people are no longer home. So anyway, obviously wishing you all the best. Try to make sure that you are giving yourselves lots of grace and finding your joy. I saw some dirt today that had me very excited. As you probably have heard, we have broken ground on our new office that is hopefully going to be ready in next spring. And I haven't been so excited by dirt and mud since I was a little kid making mud pies, but it was pretty exciting. Enjoying the little things that we can. So family dinners and homework again, which I don't know that the kids are enjoying as much as I am, but they come home and they have something to do besides Minecraft, which is great. Anyway, if you guys have any other questions, let me know. We love our patients. We love our patients' families. We want to be here for you guys, and I'm sure something's going to change, so we'll update again. But take care. Be well.